Cardiopulmonary resuscitation, e.g., in cardiac arrest. The patient's lungs are ventilated by mouth-to-mouth breathing or by a bag and mask. The patient's circulation is assisted using external chest compression. An electronic defibrillator may be used to shock the heart into restarting. Medications used to restart the heart include epinephrine and lidocaine. Temporary transcutaneous pacing. A temporary pacemaker is placed on the patient's heart to regulate heartbeats considered dangerously irregular. The physician applies electrodes to the chest wall. The electrodes give small electronic shocks through the chest to pace the heart as controlled by the physician. Cardioversion, elective, electrical conversion of arrhythmia, external. Internal. The physician may administer an electronic shock to the patient's chest to regulate heartbeats considered dangerously irregular. The physician uses a defibrillator machine and places two paddles on the patient's chest and/or back. A measured electric shock is delivered through the chest to the heart to convert the heartbeat to a regular rhythm. Cardio assist method of circulatory assist, internal. In internal circulatory assist, the femoral artery is cannulated and a catheter with balloon or other device is inserted into the aorta. Various devices may be used to assist circulation. This code should be reported for the internal insertion of such a device, but should not be used to report intra-aortic balloon pump, IABP, or implantation of ventricular assist devices that are reported elsewhere. Cardio assist method of circulatory assist, external. Devices are placed at the outside of the body to assist circulation. One example of external circulatory assist is military anti-shock trousers, MAST, which apply counter pressure around the legs and abdomen. The artificial peripheral resistance helps coronary perfusion. In a related procedure, pressure cuffs are used to assist circulation. The patient is placed on a treatment table where their lower extremities are wrapped in a series of 3 compressive air cuffs, which inflate and deflate in synchronization with the patient's cardiac cycle. During diastole, the 3 sets of air cuffs are inflated sequentially, distal to proximal, compressing the vascular beds within the muscles of the calves, lower thighs, and upper thighs. This action results in an increase in diastolic pressure, generation of retrograde arterial blood flow, and an increase in venous return. The cuffs are deflated simultaneously just prior to systole, which produces a rapid drop in vascular impedance, a decrease in ventricular workload, and an increase in cardiac output. The augmented diastolic pressure and retrograde aortic flow appear to improve myocardial perfusion, while systolic unloading appears to reduce cardiac workload and oxygen requirements. The increased venous return coupled with enhanced systolic flow appears to increase cardiac output. Percutaneous transluminal coronary thrombectomy mechanical. The physician percutaneously removes a blood clot from a native or grafted coronary artery. A double lumen catheter is passed to the area of the clot. A high-pressure saline stream, via a pump, is introduced through a lumen that has multiple jet orifices located at the distal tip. The low-pressure zone created by the jets causes the clot to break up into small pieces and be pushed through the catheter with a force that drives debris from the thrombus through the other lumen, exhaust, and out of the body. The procedure is useful to clear fatty and degenerated arteries and to modify plaques in preparation for more definitive treatment with adjunctive balloon angioplasty or stenting. Transcatheter placement of radiation delivery device for subsequent coronary intravascular brachytherapy. Using an X-ray machine in a cardiac catheterization laboratory, the physician places the delivery catheter in the coronary artery at the site of the in-stent restenosis, Reblockage in the artery. The transfer delivery device is connected to the delivery catheter. The transfer delivery device is used to deliver the radioactive seeds to the location. There are various methods for transcatheter placement, but commonly the methods involve the use of a guiding catheter. The radioactive seeds are positioned at the location for an appropriate length of time to administer radiation to the artery. At the completion of the radiation treatment, the radioactive seeds are returned to the transfer device.